Ask yourself one question. What would you do? What would you do if your computer was stolen or your patient data was hacked? What if an employee made an error and compromised your patient health information? Do you have an incident response plan in place? Are your employees trained on what to do? Do you have a data disaster recovery plan? If you do, you're in the minority. Hello, I'm Brian Sachs, co-founder of PCI HIPAA, and I know and appreciate how busy you are running your practice. We're here to help you reduce your likelihood of a data breach or loss and help you navigate HIPAA compliance. How many computers, laptops, tablets, phones, thumb drives is your patient data on? The lack of controls around technology, email, and the overall handling of patient data is exactly why HIPAA enacted the Omnibus Rule last September. So you're probably asking, why would anybody target my patient data? Why are medical practices targeted more than, say, a dry cleaner or a yogurt shop? For a hacker, your patient data is gold and it's low-lying fruit. A name and a social security number and a date of birth, it's worth approximately $500 per record for an identity thief. How many records do you have? Times that by 500 and that's what you're worth to a hacker. We also see many practices still using Gmail, Yahoo, and other unencrypted email services. If you send patient health information that's not encrypted, it's a HIPAA violation, and you're exposing yourself to unnecessary risk and compromise. Compliance is a culture that you must lead, adopt, and consistently work on. Under the HIPAA security rule, HIPAA now has mandated that you understand your vulnerabilities and you must correct them. The only way to see what vulnerabilities your office has in protecting your patient data is to take a mandatory risk assessment. After you take the risk assessment, we will prepare your risk analysis. This includes a HIPAA risk score, a summary of your vulnerabilities, and a corrective action plan. Don't ask yourself, what would you do? Take action today. Start with the risk assessment. Take 5 minutes now and take the first step in creating a culture of compliance for your practice. Click on Free Risk Assessment and put free in the code. A risk assessment costs between $600 and $1,200, but we are covering the cost for anyone that puts free in the code. We will then have a compliance specialist call you and walk you through the risk assessment. Please take 5 minutes now to protect your practice. Thank you for your time.